Dr. Gary Dombey here. Brief introduction to what applied kinesiology is. This is from the ICAK USA website. What is AK? Applied kinesiology is a system that evaluates structural, chemical, and mental aspects of health using manual muscle testing combined with other standard methods of diagnosis. It goes on to say the combined terms applied and kinesiology describe the basis of this system, which is the use of manual muscle testing to evaluate body function through the dynamics of the musculoskeletal system. Treatments may involve specific joint manipulation or mobilization, various myofascial therapies, cranial techniques, meridian and acupuncture skills, clinical nutrition, dietary management, counseling skills, evaluating environmental irritants, and various reflex procedures. So that sounds like a lot of stuff. Why do we test muscles? Well, muscles comprise 40 to 50% of the body's mass. Muscles are chemical, electrical phenomenon. They're a chemical electrical phenomenon. Muscles are an extension of the nervous system. So why not evaluate the muscles? And why not evaluate them, not whether they're just kind of working or not, but let's evaluate the quality of their function. So when a muscle is hypertonic or normotonic or hypotonic or not functioning well, there's a reason for that. And if a muscle is in any two of the states that are aside from optimal function, which is normal muscle response, then you've got problems. You've got problems with how forces are managed in the body. You've got problems with how lymph is pumped and moved and different kinds of fluids are moved in the body. You've got issues with movement, with joint health, all kinds of things. So when a muscle is, say, hypotonic, when it is weak, and when we talk about weak, we're usually talking about that sort of like in normal muscle testing, muscle grade testing, we go from 1 to 5. 5 being optimal response, 4 being not quite so much, and 3 being muscle gives out to even light force. We're really working between the 3, 4, and 4, 5 zones of muscle dysfunction. So if a muscle isn't working properly, a number of things can happen, of course. But we want to find out why that muscle isn't functioning. So we go into great length understanding all the different things that can go awry in the muscle itself, i.e. the attachments to the bone, the proprioceptive beds in the muscle, so on and so forth. And so we can evaluate that muscle or muscle group in particular as to what is going on with them to cause them to not function optimally. And so there's a whole host of ways that we can address local muscle dysfunction. Now, if the muscle itself is all intact and there isn't really any derangement in the tendon or the fascia, the fascial mechanisms or the proprioceptive nerve receptor mechanisms, then we have to look remote to the muscle. We have to look at other systems. And in applied kinesiology, we basically look at 5 different areas, or what we call in AK, the 5 factors. And these are all the different things that are remote to the muscle itself that can cause dysfunction in that muscle. One has to do with the muscle-organ relationship through the lymphatic system. Another has to do with the muscle's blood supply and or venous drainage. Another has to do with the actual direct nerve supply to the muscle. A fourth has to do with the meridian system. What I like to tell my patients, this is your wireless system as compared to your hardwired system. And the fifth has to do with the craniosacral mechanism, which is the circulatory, the closed circulatory system that circulates around the central nervous system, the brain and spinal cord. So when we find a weak muscle, the first thing we do is determine if that muscle itself has some sort of derangement. Has it been strained? Is it not draining well? Is it engorged with its own waste products, so on and so forth? And we have ways of treating that. If that's not the case, then we start looking at these other systems. So the cornerstones of applied kinesiology are the muscle test, and often we use other functional tests too as well. We use balance, we use range of motion, we look at gait, we can evaluate walking gait, we look at posture, a number of things that we look at that we can test. We look at pain through range of motion, as well as the actual manual muscle test. So that's a brief overview of what we'll be getting started talking about on November 12th and 13th in Tempe, Arizona. Hope to see you then.